The 9-man independent investigative panel set up by the government to probe the events that led to the death of Greatness Olorunfemi is set to deliver its report on its findings in a 94-page document. The panel was set up in October to ensure that a thorough investigation is conducted to unravel the truth to the circumstances surrounding the victim's death. Greatness Olorunfemi, like many others, fell victim to the growing one-chance trend in Abuja and sadly lost her life in the process after she was allegedly stabbed and thrown out of a moving vehicle. The Maitama District Hospital, however, refused to give emergency care, claiming she was brought in dead by Good Samaritans who found her by the roadside and brought her in. For more on the panel report, let's speak with the chairman of the investigative panel, Professor Aminu Mohammed. He joins us live from Abuja. Good to have you join us.
Thank you very much. I'm glad to be here.
So I know that you are set to deliver give a report of your findings, but I just wanted to talk about, how the family reacted some weeks ago, saying that there were delays in autopsy and delays in the entire process. I want to react to that because this panel was set up in October. And I also want to get to your just the areas you looked at, and the areas you touched on while you were carrying out your own findings.
Okay, thank you very much. Good evening, good afternoon, Nigerians. The issue of the incident that was trending in late September was really unfortunate, and that warranted the inauguration of the independent panel for discussion to find out, and we have three terms of reference. One, to ascertain whether she was brought in to the Maitama District Hospital alive, and if so, what transpires up to and until her death. Secondly, to determine whether she bled to death while she was in Maitama District Hospital. And thirdly, to make recommendations on how to make things better in future situations like this. And what we found out that after thorough investigation and discussions, we invited 17 interested parties that have testified, and in the process we were able to come up with our finding, and we've just submitted a report to the Mandate Secretary of Healthcare and Environment, FCT, Health Ministry. And our finding was that there was no delay in attending to her because there was CCTV camera which shows that she presented to Maitama District Hospital, AIE, at around 8:35 p.m. And in under 40 seconds, the nurse, casualty nurse on duty, attended to her without even talking to the Good Samaritans that brought her. This shows that she also did not talk to them before attending to the body of alleged Miss Greatness. And therefore, this shows that there was no question of asking for police permission or police report to attend to her. The casualty staff, 2 other doctors saw her in the next 3 to 5 minutes, and all of them confirmed that she was brought in dead because there was absent reflexes, absent pulse, absent cardiac activity, and also the pupillary reflex, the pupils were dilated and fixed. So on the other aspect of whether she bled to death while she was in Maitama District Hospital was also found out not to be correct because she was not bleeding from testimonies of the driver and the onlooker. There was no drenching of the seat where she was sitting, and also examination of the cuffs. The lady is wearing a cream blouse which was not stained with blood, and therefore all the allegations that we found out that were not actually as portrayed. Even the person who claimed to be in a co-passenger in the same vehicle, actually the event of the so-called co-passenger occurred a day after Ms. Greatness incident, which was 26, but the co-passenger was 27. And we corroborated with the debit in her account that she said was debited by the One Chance team, that it was on 27th of that of September 2023. So we made far-reaching recommendations that are going to
and that's where I want to come into. Prof, apologies for interrupting you there, because it will seem as though
you're welcome.
Your findings and report have exonerated the Maitama District Hospital. But some people will say, look, these laws are there, and some hospitals do not, follow these laws, and laws are not enough. So I was going to then ask you, what your recommendation would be in this particular incident, and then, in averting situations like this.
No, I think what was reported was not correct, that we have exonerated anyone. Ours is a fact-finding, and we find what actually transpired and relate it as so. It is the authorities that will now look at whatever we reported and whatever we recommended and determine whether the hospital is exonerated. But we are just telling you our finding. On our recommendation, we've made far-reaching recommendations that will ensure seamless handling of patients at the casualty, where we can improve the manpower, we can expand the facilities, we can even additional hospitals, because these hospitals were to cater for far less number of population at the time they were done compared to the current population of Abuja. Therefore, we've recommended for additional district hospitals, additional manpower, additional facilities to ensure that there is seamless care, health care, and effective health care delivery to the populace in Abuja. And also, we also recommended that the Corona law, which was inherited from the colonial masters, that is yet to be reviewed, should be reviewed, because it is delaying the possible inquest and definitive autopsy for criminal cases like this. You can imagine that up till now, the pathologists or the authorities of FCT have not received the letter for permission for a detailed autopsy on her body so that they can unravel the definitive cause of death.
Thank you so much, Prof, for your time. We'll not be waiting for a statement from the authorities. We've been speaking with the chairman of the investigative panel into the death of Greatness Olorunfemi, Professor Aminu Mohammed. Thank you for your time, Prof.